Let me just start briefly uh, with the procedural background. As you know, let me pull up my packet here. Um, there we go. The county executive, it started with the governor. The governor issued an executive order with the stay-at-home order. Then he several times started lifting it, but allowing local governments to keep restrictions, uh, keep some restrictions based on their own, you know, statistics. And as you know, the Montgomery County's based on the science and Dr. Gales has consistently been a little behind the state. We're at phase one. The governor on June 10th issued an executive order moving the state into phase two. What the executive has done is last night he signed an executive order which would move the county into phase two. I do want to point out that just this morning I received a revised executive order, which is not in the packet because I just received it. I think Dr. Gales is here. But the difference between the executive order in the packet that was signed yesterday and the revised executive order signed this morning is the only difference is swimming pools. Yesterday's executive order said swimming pools can only be open for lap swimming. Questions arise, well, some pools in the county are not even big enough for lap swimming. You mean they can't open at all? So Dr. Gales has agreed that it doesn't have to just be lap swimming and has put out some guidance for county pools, which is linked to the new executive order. The new executive order would formally lift the stay-at-home order, not saying everybody leave home, but you can certainly leave home to patronize any of the businesses that are allowed to be open or any of the organizations that are allowed to operate. And it creates some general operating and social distancing requirements for all businesses, organizations, establishment, and facilities that are permitted to open. Numbers of people, square footage per person, and wearing masks indoors. It permits indoor and outdoor gatherings of up to 50 persons with restrictions. Everything is with restrictions, permitting childcare facilities to open with restrictions, fitness centers to open with restrictions, and they're listed in the executive order. Again, food establishments, restaurants, bars to permit on-site food consumption, both inside and outside, with some significant social distancing restrictions. Miniature golf can reopen with restrictions. Manufacturing businesses can open. Indoor malls can reopen with restrictions. All offices can reopen, again, with social distancing restrictions. Certain outdoor recreation, youth camps, and sports can operate with restrictions. Personnel services establishments can operate with restrictions, including some nail salons. They've already allowed, I believe, barbers and hairstylists to open. And there are certain types of personal services that are still need to be closed. And then the information on pools that I already described to you is covered for both indoor and outdoor pools. It loosens the restrictions on religious facilities so that they can operate under the same general operating procedures imposed on other businesses. They can have indoor services with social distancing restrictions. Same for retail establishments. and car washes can reopen, and pick your own farms can be open with restrictions. So with that, I see Dr. Gales is here. You may want to do your update now, and then you can move into the public hearing, and he can answer some questions that you might have.
Thank you very much. And Dr. Gales, thank you for being even prompter than prompt. You got here before you were supposed to. Could you please comment?
Good morning, everyone. I try to be, again, nimble and flexible. That's what emergency preparedness is all about. I wish that could apply to, as a tennis player, I wish that could fully apply to all of my tennis skills, but I do the best I can. Always a pleasure to be with you all. And I'll go through the update quickly to leave space for time for questions and conversation. Want to preface the comments as well as the conversation related to reopening with this. We continue to be committed to looking at data and using data to guide how we move forward, particularly in terms of the types of activities that we are recommending to be reopened, how they can be done safely, and the provisions within which they can be executed. This is vitally important because we have received feedback from a number of places that a more measured approach in terms of what we have taken is the right way to go. Recently we've heard that and received feedback from a number of different epidemiologists locally, as well as when you look across the nation. We wake up today where we see other jurisdictions who have rushed and moved forward very quickly. I won't say rush because that seems judgmental, but have moved forward very quickly in terms of reopening, taking a less measured approach, and have now had to walk back some of those reopening provisions. And we have been very clear that we don't want to do that. We want to continue to see improvement in our numbers and progress in our numbers in terms of suggesting that they are not anomalies, but sustained decreases and sustained improvements. And consistent with that, and consistent with the guidelines from the CDC, is the recommendation that each jurisdiction, when you move to a new phase, have a minimum of 14 days to show in terms of what your trends are looking like. And with that in mind, we felt that the numbers had moved in the right direction to allow for some aspect of further reopening of certain activities. And for the folks watching at home, the way those activities were determined was looking at and assessing the risk of exposure, the risk of transmission. And so for those activities that may have carried a higher score, so to speak, in terms of risk that we are allowing, there have been very strict guidelines and provisions put in place to minimize those potential factors of transmission. That's why we continue to emphasize physical distancing, face coverings, capacity limits in terms of the number of folks in particular spaces. So I just want to make sure that folks understand at home that's what we continue to use as our guiding principle. And I will say this unequivocally. I actually did an interview this morning with a reporter who was saying that, lots of jurisdictions are feeling pressure. Or, there have been a lot of public health officials who have resigned. I think of the data scientists in Florida and a number of other places feeling pressures in terms of the non-science factors in terms of reopening. And I was able to respond to say that, look, I'm very fortunate to be in Montgomery County, where we have a county executive and a county council who are committed to using data and science and valuing the input from a health perspective in terms of making next steps. And so I just want to say I appreciate that feedback and appreciate the space to be able to provide that guidance and be able to have conversations around the value of health and the value of science and data. Now, that said, moving forward quickly to the numbers, this morning our case count is 13,709, which represents 52 new cases from the previous day. We have seen, fortunately, a number of lower case days compared to where we were before, and our overall, the 3-day averages are continuing to decrease. Now, it's important to put that into context. Again, we want to continue to expand testing even more than we have. But these number of new cases are coming in the setting of increased testing. So we're seeing a decrease in new cases with an increase in testing. In fact, we have now tested almost 74,000 residents in the state and run almost 85,000 tests. Again, we know that we need to do more, and we're committed to doing more. And that represents 7% of our total population. The test positivity rate currently stands a 7-day average of 8.1%. Our R0 value in the last 5 days has ranged from 0.56 to 0.97. So we continue to be below 1.0. Additionally, we are, again, coming up with multiple strategies to increase and enhance our testing. We have added an additional site at the Wheaton Rec Center on Fridays. Additionally, we have finally moved forward with project, well, I won't say the name out loud, but we'll publicize that shortly. But being able to stand up our mobile testing unit, which will allow for pop-up testing. And as a reminder, consistent with our strategy to focus on, continue countywide response, but really focus in on those 10 zip codes, is to be able to identify multiple venues where the county can do testing, but also multiple sites and opportunities to partner with community agencies to execute testing, most likely through dissemination of kits to them to be able to share with their respective clients or members. And we do have a number of those conversations in work now. They're not finalized, but they are in detail and will be announced once they are finalized. Additionally, we're emphasizing and consistent with the state's approach in terms of rooting out cases and the viral load in our nursing homes and assisted living facilities. We are prioritizing that group to be able to provide testing on a serial basis. So every 5 to 7 days, conducting testing in those sites for residents and staff members until we get those numbers down to 0. Additionally, we are also open, again, looking at other strategies where we can increase and enhance testing across the different modalities, including nasopharyngeal swabs, as well as the oral self-collection kits, which are a high throughput option. And we will be disseminating those kits to a number of other agencies, including at least 2 hospitals and a number of county agencies and organizations for county employee testing, as well as other venues prioritizing those who are first-line responders and essential employees. The second component that I wanted to provide some additional information on is our contact tracing component. We did receive an extensive list of questions from Councilmember Reamer. We're working on providing answers for that by the end of the week. But in terms of some early updates on that, there was a question about we have utilized our school health nurses to provide those services over the last several months. We had 79 nurses participating in that process, and 55 of them will be staying with us over the summer. And our strategy to augment and supplement that includes working with a contract agency, which is in the works in terms of recruiting individuals, contact tracers through the contract mechanism, as well as reaching out to community organizations. We have one meeting, again, that I've mentioned with Casa de Maryland this week to discuss recruitment of individuals within their organization. We have reached out to a number of other community agencies to represent diverse sections of communities, including our Asian communities. I know that's broadly defined. Our Ethiopian communities, as well as our French Caribbean communities as well. So that is in the works. And the numbers that we have in terms of contacts. So with the cases from last Monday when the state system went live and we were brought into that, we have, for individuals who have been contacted within the 24-hour period and completed in 76% of those cases. Now, 100% of the cases have received a call within the first 24 hours. The 76% is representative of individuals who were called and talked to within that 24-hour period. Now, the remainder the reason why they are not considered in that number is there have been multiple attempts to contact them and they've received no answer. And we continue to develop strategies to figure out how we can reach those folks. At a minimum, based upon the address that is in the system, individuals will receive a notice of their results and also a request that they follow up with the health department in terms of contact tracing. And that is consistent with contact tracing protocols that are used in public health. Again, in the past, particularly for sexually transmitted infections. And so we continue to refine that and figure out strategies where we can engage folks. And part of that is the state has conducted a PR campaign on the value of contact tracing and educating people on why you need to answer that call and answer that phone. That's something that we're working on internally here as well. And I think working with the community agencies will prove very valuable in that aspect in terms of being able to educate the different communities on who's calling you, why you need to answer the phone, why it's safe to answer the phone, and how that data may be used. We also have further conversations with the state on getting additional assistance from the CDC from an epi and a surveillance perspective. And I believe our next follow-up call on that is tomorrow. I think that covers it for now. And I know there'll be other questions related to that, but also questions related to the reopening for phase 2 on Friday. Happy to answer any questions.
Thank you, Dr. Gales. Because of the late hour that, or literally a few moments ago, that we received the information about the pools, are you familiar enough with the other areas that have opened their pools or opening their pools, and the difference that Montgomery County would have versus those areas?
So the language that we have as far as the amendment that was put forward related to pools is consistent with the state guidance. I think we have put in additional language in terms of capacity. So that is the difference between, our language and level of reopening the pools versus the state. So in each instance, I don't believe the state did not put in provisions to say lap swimming only. It said pools are open. My concern is from the health perspective is that the activity carries a lower risk. But what we know is in many of these situations, the activity may carry a lower risk, the actual act of swimming, but making sure that we do what we can to discourage any type of gatherings or other situations or congregation that might actually be the factors that enhance transmission. So that is why we put in extra provisions in terms of capacity, consistent with our capacity-driven approach in restaurants, retail settings, things like that, to limit the number of people who can be in those spaces safely at any given time.
Thank you. What I'm going to do is ask for to discuss the order, and then we'll go to Earl. So, Councilmember Bremer is next.
Thank you. Thank you so much. Quick question, Dr. Gales, are you also joining us at 1:30 for the public hearing followed by action on the order?
No, the public hearing, I started to text you back, Hans. This public hearing is at 11:15. That was advertised for 11:15. So this public hearing will not.
There's nothing this afternoon. Right now, we're doing everything we're doing on the order.
I want to be clear. We have public hearings this afternoon starting at 1:30, but not for this topic, not for the executive order.
Okay,
the
great.
Executive order public hearing was advertised for 11:15, and that's when we'll have this one.
So I have a few questions that have come about the order that I'd like to either I need to understand, and I don't know if we need changes or not, but I'm sort of a little bit confused. The first is about youth sports. If I'm reading it correctly, the governor's directive around youth sports that is in effect outside of Montgomery County now, which our new phase 2 would basically sync us up with the governor's order around youth sports. If that is the case, which I think it is, then basically youth sports are open. There's no spectators, I think, but basically they are open, and there's no distinction between types of sports, whether they are low contact or high contact. And I just want to clarify that, because I think the press release may say that it's low contact sports, but the actual order is tied to the state order, which really is just all youth sports can go back with distancing and masks and things like that. Dr. Gales, could you please help me understand that one, please?
Yes. So, and I know Earl is also here, and I know part of his presentation loops into this as well. So I will pull him to the mat as well in terms of providing feedback.
Sure.
In terms of so our preference again is low contact. And the difference is, so our original phase 1 was low contact, capped at 10, and then it moved to the governor's provisions to 15. And so that is, your assessment is correct otherwise in terms of no spectators, that kind of thing, the group being confined to that. And again, making sure that those provisions are in place that you mentioned in order for them to be able to participate and be active.
Earl, are you available? Because again, when I read the governor's order on youth sports, it really says you can use masks and do distancing as best you can, but youth sports can resume fully. There really doesn't appear to be limitations.
The intent, certainly the intention our side was to expand to allow additional, I think even in our chart it says expanded youth sports limited to low contact. We'll have to follow up on, Sylvia Kinch is certainly much more adept on all of the health orders simultaneously, and I have to verify with her. Certainly our intention is for it to be limited to 15 and low contact sports, similar to the expansion that we've seen with the outside camps.
Okay, well, it's
We'll clarify that.
I could be wrong. I'm doing my best to understand all these documents and how they tie together myself, but
yes,
I believe that.
And we could be wrong too. That's why what I'm saying. So clearly the intention is, and we're going to make sure that is the case. I'm taking a note now to go back to talk to Sylvia. Clearly our intention is for it to be 15, just like the outdoor day camps are, and with low contact sports as they're defined under the.
So to that point, Dr. Stoddard, if that's your intent is to limit it to certain low contact sports, we'll also need you to specify at least what the most common sports are and how they are limited.
And so basically the only change from phase 1 to phase 2 is expansion from essentially 10 to 15.
Okay.
So we'll define it the same way we defined it as phase 1, but we're just expanding it from 10 participants to 15 participants in phase 2. And then as we noted in the phase 3 graphic, that's when we'll expand to, in phase 3, we would expand to other sports that have more contact.
Okay, well, as I clicked through the links in our order, it led me to a state order that seemed to no longer have that limit. The second question I have is about masks. It does not appear to me that the state requires masks outdoors for customers. It only requires them indoors for customers. And there's not like a general mask requirement for people when social distancing is difficult wherever they may be, indoor or outdoor. And so first of all, I wanted to ask about that because, as we see like downtown Bethesda, downtown Silver Spring, we're starting to see a rebounding of outdoor, commerce, but there's probably confusion about mask requirements. So again, it does appear to me that the state, and we are relying upon the state, as I understand it. The state does not have that requirement. It only is a requirement for indoors. And then related with youth, the state requires young people, children basically, to wear masks when they're customers in a store. But I don't think it requires them to wear them if they are, for example, in a childcare setting or a school setting. And that seems like an inconsistency that we may need to resolve. It. I think we should mandate them, in all settings, but we haven't really tackled that one as a kind of a big issue. So can you provide some clarity on the mask requirements, please?
Yes. So, and thank you for I received your email last night, but knew we would be speaking today. So the first question in terms of the mask for children, our language is clear that children over the age of 2 should be wearing masks in those settings that you talked about. So the guidance that has been provided, at least from childcare, things like that, and the expectation is in school settings or in any of those social settings
Anywhere.
where physical distancing is difficult, that children over the age of 2 should have on face coverings. And secondly, in terms of our expectation as well, is that when you have customers who again are in physical spaces, whether they're outdoor or indoor, where you can't where physical distancing is not possible, is the expectation that face coverings should be worn there too. Now, I think there is a nuance, and I was trying to think through and make sure that I thought through where you were coming from. So feel free if I'm not in the right direction in terms of what you were thinking. Is I think the instance where there are customers who are in outdoor spaces that don't have a mask, for example, at restaurants. So the language is that, when you're seated at your table, whether you're indoor or outdoor, and you're eating and drinking, that you aren't required to have on a mask during that activity, but any other time you should have on a face covering, again, in settings, whether they're indoor or outdoor, where physical distancing is not possible.
Okay. Thank you. I as I was investigating it, it was not clear to me that that's what our county required. I think there may be a lack of syncing somehow.
Okay.
And then I wasn't aware that our blanket requirement is children 2 and over are subject to mask requirements, whether in a childcare setting or as customers, so I think that could be clarified. I think we could use some specific direction around that. Last point I want to make, the possibility that reopening could lead to an increase of cases, as we have seen in other jurisdictions around the country. What are our metrics to reverse direction? Have we started to develop those? And if not, I think as a follow-up, we ought to also provide a transparent roadmap for when we would have to reverse direction and close things up again.
Well, I think the same metrics that we're looking at now to move forward are the same metrics that we would look at in terms of moving backwards, not in terms of, let's just say this, we caught a lot of flack for having, some said we had too many measures. For example, why would we look at hospitalizations and those kinds of things? And it's interesting that I'm using hospitalizations, for example. Hospitalization capacity is one of the things that a lot of these other jurisdictions are being hit with right now. I'll use Houston and Harris County, Texas, for example. They, in their first wave, they didn't utilize a lot of their surge capacity in terms of hospitalizations, but now they went from not utilizing that to reopening to their hospitals are at full capacity, and they're having to, I believe, utilize their football stadium for additional space to be able to open up and increase their hospital space. So again, the same measures that we have used to guide us to move forward are the things that we're going to continue to follow, both in terms of can we move forward or do we need to move back. So, seeing a significant increase in cases, our average has dropped significantly, but if we see that change and turn around and we see that start to pick up and have sustained increases, that's a red flag. If we start to see the increase in utilization of hospitalization rooms, both from an acute perspective as well as a significant change in our ICU capacity, those are red flags as well. Additionally, I think there's some other measures that in the background. For example, we've talked about our R0 value. If we see that number start to significantly increase as well, for example, I think DC's R0 is set at, I think, below 0.84 or something like that. If we start to see that increase over 1 and stay over 1, those are the things that we would say, we've got to have an emergency conversation. We've got to come back and may need to make some decisions about moving backwards.
Okay, thank you. I'll yield.
May I add to that a little bit? Also, if we saw sectoral differences, so if we saw restaurants consistently being unable to follow the guidelines, and that was associated with an uptick, it could be a more localized decision around And so there is a gamut of reclosing. We don't want to go down that road, but there are several options. If we saw an outbreak in a particular restaurant or facility, that would be an obvious one thing where we shut down. But then there could be also, we have the ambassadors out looking at businesses broadly. We've done over 1,100 in the last 8 days. And so we're going to be out with eyes on trying to observe what people are doing. If we saw sectoral differences where one area was having a consistently harder time meeting the expectations that have been set forward, the shutdowns could also be targeted towards those locations that are having that problem.
Okay, thanks. I will yield back. I'm going to look while we talk at the youth sports and the masks. I'm going to send an email to Bob Drummer and make sure I understand things correctly. Thank you.
Thank you, Councilmember Glass. Well, before Councilmember Glass speaks, let me just make sure that Dr. Gales and Dr. Stoddard, are you under a time constraint today? The fact that you started early doesn't mean that you get to leave early. You know that. Go ahead.
My time, I am here until 11:06.
Oh, wow. 11:06.
No, I'm kidding.
Oh,
I'm
okay.
good.
So,
I'm good today. We're
Very good. So your clock is a little different than mine then. I only have 11:04. Okay.
I'm good.
Councilmember Glass, please.
I'll make this quick, as I always try to do. Thank you for this update, and I do have some clarifying questions. But let me take a step back. And as Councilmember Reamer was mentioning, people are re-engaging, right, in social behavior. I and hundreds, or let me say thousands, of neighbors here in the county have been engaging in rallies and protests in support of Black Lives Matter. And I'm curious to know how or if those outdoor events have resulted in any uptick in testing, positive testing, hospitalizations, or anything else here in the county.
Sure, that's an excellent question, and one that lots of people are asking. I think what we can say is there have been large gatherings for over 2 weeks now in the county. And as we talked about before, particularly in the very beginning when the larger gatherings were in place, the incubation period for the virus is anywhere from 2 to 4 days to upwards of 10 to 14 days. And so since those large gatherings have started, we've actually seen, and not to say that there is no risk behind it. Let me be very clear behind this for anybody watching, anyone quoting in the news press, is that what we have observed here is since that started within the county, we have not seen an uptick in cases. Now, we know that us and our peer jurisdictions in DC and Prince George's and Northern Virginia have worked hard to increase access to testing so that individuals who have participated in those activities can get tested, and we hope that that number is increasing. But as of now, we've not seen a significant uptick during that setting. Now, I would like to actually reference, last night I was watching an interview with the mayor of Phoenix, Arizona, where they actually have seen a significant increase in cases recently. And the question was asked to the mayor, do you think this is attributable to protest? And her answer actually, I think, spoke volumes. She said, actually, no. There have been increases in cases across the state in areas where they haven't had large gatherings or large protests. And in fact, the epidemiologist within the state and within her jurisdiction attributed the increase in cases tied more directly to reopening quicker and faster as opposed to the large gatherings. Again, I preface that and say that it's not to say that there's no risk in participating in those activities, particularly if you're not adhering to and following the public health guidance. But the data we have so far does not support a significant increase in cases that correlates to the time frame within which the gatherings have happened.
I appreciate that, and I'll share with you firsthand accounting of. I've been to a number of rallies, and everybody that I have seen has been wearing a mask, and I even appreciate the organizers who have been mindful of the social distancing and even going as far as wiping the microphone in between speakers. And I think those actions have helped protect those of us who are participating, those of us who are speaking. and try to stem any spread of this. So thank you for that update. One other just general question before I get into the specifics of the proclamation or the executive order. As we're talking about testing and the continued expansion of testing, I have been receiving a number of correspondence from people, particularly in the downtown Silver Spring area, who say that there is no place within walking distance for them to be able to get tested, that they would either need to take public transportation or get in a vehicle, which many of them don't have, which is why they're asking. Are there any efforts to expand testing in downtown Silver Spring specifically?
Yes. So consistent with that again, and I know 20910, which is downtown Silver Spring, is in one of those zip codes. And so again, what we're looking to identify is not only venues that are more transportation friendly in terms of being walkable and accessible, but making sure, that we create the opportunity to be able to do walk-up testing as opposed to, having to have an appointment, those kinds of things. So our team is looking to identify venues within those respective zip codes that would be good candidates for the county to do testing, but also to identify community partners who have venues in those spaces already to support them in their testing outreach efforts as well.
Okay, well, and I think it's also important to note that as people have been fielding those questions to me, and I've been looking through the website, seeing the updates, it does not appear to me that the pharmacies, the CVS, Walgreens, the others are actually in that zip code are offering testing.
That's correct.
Which goes back to an equity problem. And so we need to figure this out so that people who live in that community are able to get testing without having to figure out transportation problems. Again, an issue that we've been talking about for a while, but it's becoming more acute. So two quick questions just regarding the order itself. Regarding pools, I know that there was some clarification. Mr. Drummer explained it a little bit, but I'm going to ask for a different explanation that maybe you can provide. It says that pools are open with restrictions, and so explain what those specific restrictions are. The 50%, the lap swimming, open swimming. Can you just share with everybody who's listening what pools are open and how they can best be utilized?
Sure. So the clarification in the amendment that was sent over reflects an acknowledgement that public-private pools can be open indoor and outdoor. The requirement is not that they have to be used for lap swimming, although that is the preference. But it does provide strict capacity limits in terms of how many people can utilize those spaces. Because again, the actual act of swimming itself is not as high risk as some other activities, but it's the other things associated with it, again, in terms of shared equipment and the ability to congregate in settings. And so what the language requires is that there are capacity limits that actually go beyond just saying 50% capacity. It says if you have a pool, you've got the square footage divided by 36, which gives you your number in terms of how many people could ideally safely physically distance themselves in a pool at a given time. As well as provisions to talk about how shared spaces and surfaces need to be cleaned on a regular schedule, again, to mitigate any potential increased risk of transmission upon shared surfaces.
Okay, thank you for that explanation. And last question I have was directly sent to me by someone who does youth programming in the art space, and specifically the question is about the phase 2 requirements regarding youth participating in indoor exercise classes, and specifically it's about a dance program that a constituent has. Are participants in such programs, indoor dance programs, required to wear masks even if they are physically distanced?
I think the expectation and consistent with our guidance for gyms is that we would expect people in indoor settings to wear face coverings while they participate in those activities.
And so let me just, one follow-up on that. Is it an expectation for people engaging in indoor activity to wear a mask, or is it a requirement?
Well, in the language for gyms, we require that they wear them.
Okay. So gyms are a requirement, but other kind of activities, they would be preferred.
I don't know how the indoor dance studio is being. I don't want to get into the weeds of these. I know Sylvia is on the call, but we are as the gym example. That's probably in my head the closest thing to what you're describing. We are requiring that they be worn.
Great. Okay.
Can I add a real quick comment to that? We are seeing, I think, observance wise, so much of mask wearing is the public unity around mask wearing. So the more people who don't wear a mask, the more it encourages other people not to wear masks. And so we've very much attempted in this modification of this executive order, and sort of you'll see this paired up in our messaging going forward. We're like, if we're going to open things up, we have to have a strict expectation of people wearing face coverings, even in places where it might seem uncomfortable to do so. Largely because the more cracks in places that we allow them not to be worn, the more it encourages people to feel like there's some, they can draw back from doing it. And so I think we are intentionally being pretty strict in the use of those basic protections around good hand hygiene, face coverings, so physical distancing, because we know that while we open more things up, it runs counter to the message that there's still a huge problem in the community that we need to deal with.
And that is why I was diving into the question regarding requirement versus encouraged. So I appreciate your explanation. Mr. President, I yield back.
Thank you very much. Ms. Kinch, did you want to comment on the question about whether it's a requirement to wear a mask or not?
Yes, thank you very much for acknowledging me. The executive order would require participants in gyms, fitness classes, of which I believe the dance class would qualify, as well as other sort of exercise activities to wear masks. So it would be a requirement.
Thank you. And I did receive an inquiry about the 200 square foot for all activity. The city of Gaithersburg has contacted us, and they wanted to know, because it says for all events, how did we come to the idea that it's 200 square feet? And I guess that's for indoor and outdoor events. And is there any? Could you clarify that in any way, please, Dr. Gales?
Excuse me. Sure. Actually, Dr. Stoddard was our capacity square footage guru in doing that. So the reason why we went to a square footage rule is we had a series of conversations with health officers across the state, across the region, and we could not find any scientific data that supported using capacity. Now, when we look at square footage, factoring in square footage and capacity allows you to think, okay, strategically, what's the physical space, and if I have physical distancing parameters in place to keep people 6 feet apart, recognizing, that's not always going to be, it's going to be fluid. What's the maximum number of folks I can put into that space to recognize that and acknowledge that? And so that is where that's the rationale behind using square footage versus capacity, as well as some of the preliminary basic science behind why that number is used, as opposed to, a 500 square feet or 1,000 square feet.
But outdoor is different than indoor on that. I mean, you're saying it's 200 for any event, right? 200 square feet for any event.
Well, it's the same principle in terms of you being able to be within a space 6 feet apart, and to safely be able to physically distance from one person to another.
Okay. Councilmember Auburnoz.
Thank you, Mr. President. Many of the bases have been covered by the very astute comments and questions by my colleagues, but I'll begin with this just to frame it based as a follow-up on our discussion last week regarding the GO teams and the rapid response teams. And this is more of a comment for our county residents because I think all of us on the Zoom call know this to be true. The great news is that numbers within the county are going down, but just as in the entire state, the numbers in Prince George's and Montgomery are not going down at quite the same rate. The same is true within Montgomery County. And we continue to have significant issues in a handful of zip codes. And the numbers are probably higher than we realize because many of the people within those zip codes are in fact not being tested. And we have worked hard to establish a structure. And I appreciate Dr. Gales and Dr. Crowell, both of you, spending the time to respond to our questions. And I know you're going to be responding to the letter that we sent with more specifics on strategy moving forward. But I want our general population to understand while the numbers holistically across Montgomery County are positive, they remain troublesome and very challenging in specific communities. And so I do think moving forward, we're going to need to flood those communities with masks that are free, particularly as businesses open and many of the people that reside in these communities work in those businesses. And we are also going to need to triple down, not double down, on the efforts that have been taken up until now to ensure comprehensive testing within those specific communities, to address the transportation issues that Councilmember Glass brought up, and other issues that are unique to those communities. And as we discussed last week, that's particularly true also within our disability community. And so it will be critically important that we provide on-site testing more so than we are now. And I know we all know that, but I just want to underscore that for our residents at home, that we are way not out of the woods. And in particular within those specific communities that we're all familiar with, Middlebrook, Long Branch, White Oak, that's where the highest concentrations of cases remain. So that's sort of a headline that I don't want to lose sight of. The second thing is with regards to pools. So I know a thing or two about pools, and the operation of pools and the management of pools is difficult even in the best of times. And this is going to sound like Debbie Downer here, but drowning is the leading cause of death in children under the age of 11 across this country. And like so many horrific and tragic indicators, it disproportionately impacts communities of color that don't have the same access to taking classes on how to swim. And so I am deeply concerned because I know that pools and their operation, again, even in the best of times, have a hard time recruiting lifeguards. It's a profession that for whatever reason, people don't take up as much as they used to. And so pools are going to be compromised in having to manage and operate these additional standards, which are all legitimate and are definitely necessary, and I completely agree with. But I think where I'm going with this is I would like most of the provisions that we put in place and most of the instruction is geared a little bit more for the business to kind of help them guide what the proper information is. But specifically as it relates to pools, we need something that is specific to families. And just as even before the pandemic, we encourage families to ask questions about what the lifeguard ratio is to the participants in the pool. We make sure that information goes out with regards to sunscreen. And my God, my 3-year-old, it's hard enough getting sunscreen on her. I don't know how we're going to keep a mask on. I don't know how that's going to work with our family going into a pool. But I think we need clear instruction and direction and guidance for families on what they should be looking for, how they should proceed. That's a unique set of communication than the general information we're providing, which again is a little more skewed towards the pool operators themselves. And my goodness, that needs to be bilingual. That needs to be in multiple languages. And we need to flood that information in those communities that are disproportionately impacted by drownings and other terrible indicators. And I just, so I'll stop there for now, but just to underscore why it's important for us. And it's not going to be perfect. we're relying on science to help. But when it comes to this particular item, it's going to be we're doing the best we can with the information that we have, and each family is going to have to make their own individual decision. But families who spend the entire data pool are going to have to rethink that strategy and rethink that activity. Spending pockets of time there is going to make a lot more sense. And I know pools are already organically implementing policies like that themselves, but it's something that I think we're gonna need to provide a little bit more direction on to families. So Dr. Stoddard or Dr. Gales, are there any plans for us to provide more concrete communication for families on how they should proceed, things they should be looking for before they go and do activities like going to a pool?
We could certainly, I'm taking it down. I think it's an excellent point for us to have that out, and we can work on it this week and have it out before Friday. I think it's certainly an absolutely worthwhile thing for us to do. And obviously, I think your point is well taken. It can't just be a communication. It has to be some actual outreach. And I'll certainly work with Director Riley on developing things coming from REC as well. Just to be clear too about the pools piece, while we are going to permit, we're going to allow sort of public pools to move forward. The county, to be clear, the county pools are not going to open on Friday. We still have some time to get in place. Exactly as you've said, getting the lifeguards in place is taking, it takes some time, getting all those things, the temporary employees. Councilmember, I don't know, you are as versed on this as anyone is. And so I'm certainly not speaking to you directly, but just I want to be clear that, this is going to be a big communications point. But we know that we've got to provide some additional guidance along those lines to families. And I've taken that as a piece of feedback, and certainly we'll work on that this week.
Thank you.
And I'd just like to add, actually, to the first part of your remarks, Councilmember Albanos, I couldn't agree more. I get probably anywhere from 30 to 50 emails a day from folks asking to open up segments of society. Lots of folks are focused on, swimming pools for one, and other areas, and have asked why we don't, why are we limiting folks' liberties and limiting business? And folks don't understand that even though you're right, even though the overall numbers, and I feel like I'm repeating something that we've talked about before, even though the overall county numbers have shown improvement, we know that there's still pockets in our community that are disproportionately impacted. And that's related to COVID. That's related to any of the conversations we've had about health inequity and health disparities before. And so for those of you watching at home, wondering why we don't just rush to reopen, is until everybody in our county is able to enjoy those good outcomes, we have to be measured and act with some sense of caution. And so again, that underscores our efforts to identify, again, those zip codes that have been hit the most and disproportionately impacted the most, to be able to develop strategies and be very active in terms of getting more testing opportunities there, enhancing the contact tracing, enhancing the outreach and education, as well as the increased linkage to other social support services that many of those communities need.
Thank you. And I'll end with this. I really appreciate the special attention you've paid to some of those constituencies, in particular our faith-based organizations. I think we've handled that with great care and understanding of the unique aspects of so many of these different sectors, but faith-based being one of the best examples. So I appreciate those efforts, and thank you all. And just underscore the mask issue that Councilmember Reamer mentioned earlier. We were at Brookside Gardens with my family. It was our first big venture out in 3 months. And it went really well. I was actually pretty pleased. And most people were wearing masks, but there were certainly some families that were not. And so I think just out of an abundance of caution, we need to continue to hammer that home, that is critically important for everyone. Thank you all very much.
Thank you. Councilmember Friedson.
Thank you so much. Appreciate it. Appreciate this discussion and the fact that we are moving forward deliberatively and thoughtfully and following your public health guidance. I also appreciate the fact that we're moving a bit in the direction of following the state guidance, but when it is safe to do so in a number of categories. Some of that changed from what was initially sent around, I do think it is helpful to make sure that we're as clear, consistent as possible, and that it's guidance that's easy to understand and for residents and businesses to comply with. Ultimately, we could come up with perfect guidance, but unless we can explain it to folks in an easy to absorb and understand way, it doesn't really do what we need it to do, which is to keep people safe. So I appreciate the fact that you are trying to strike that appropriate balance, and I think we're moving really well in that direction. Speaking of that, do we have an understanding of where we are following the state's guidance starting on Friday and where we are differing from the state's guidance? There's a number of the items in the executive order where we are now doing what the state is doing. We're just a little bit behind them because our numbers are dictating it to be such. And there's a number of areas where we are doing it in a different way than the state is. Do we have, I think that is some of the confusion and some of the discussion that we've heard up to this point. Do we have that detail? Do we have that written out?
I know that we have a specific crosswalk that does what the state is doing versus what we're doing. It's certainly something that we're aware of. I don't know if we have a graphic for it, but I think that's something we could work to develop.
Yeah, I would strongly encourage it.
Okay. I think
if we had a chart, that there's a number of categories by category that are pretty specific in the chart that we have that goes phase 1, phase 2, and phase 3, and in the executive order. If we have a similar chart to say, okay, here's what phase 2 looks like. This is the state's, guidance, and starting on Friday, this is what our guidance is going to be. And if it's the same, great. And if it's not the same, just detailing what the difference is. I think it would be really helpful for folks to see that, because they are getting a lot of competing and sometimes even conflicting information, and it's very hard to decipher if you're a resident or you're a business trying to figure out how to comply, how to make sure you're keeping your family and your employees and your customers safe. On the pools item, I appreciate it. I've also gotten a lot of questions on this. Some of it is because the order and the HHS guidance was different when it was released yesterday. So I'm glad we're trying to clean that up. I know there's a lot of moving parts here, and we're all trying our best to try to keep up. Have we received in writing the new executive order? Have council members? I know I heard our attorney did, but have we received the new guidance? Has that been sent around? Mr. Drummer or Dr. Stoddard? Or?
Yeah, I'm not sure that we transmitted it to council staff. I'm not sure if it's been transmitted to council members. Mr. Drummer may be able to.
Yeah, I will send it around now. I'm not sure. I didn't realize it hadn't gone to everybody.
Okay, yeah, I mean, if we're voting on something, I think it'd be helpful for us to have it before we vote on it.
Absolutely.
It seems like a fairly basic standard. Thank you for that. When should residents expect for the new clarified standards written out to be posted and published for their consumption?
So for pools,
yeah,
there's actually in the executive order, it's linked directly, and so there is a county website that already has it up. We'll just make sure that it's more readily available and advertised for people to see it. But you will see a direct link, and you certainly can share the link from the executive order out that states the rules.
Okay, so right now, if we were to share the revised executive order with constituents, they would get the proper and appropriate information.
There's a direct link in the executive order to the pools guidance. Yes.
Okay, great. A question on gatherings. There's been a lot of questions of what is a gathering and how are we defining gathering. Could you just share that information of what the standard is for gathering? Are we using a definition from the state or from the CDC? Are we having our own definition? It seems like we've been pretty clear to define what is a food establishment, what is a certain type of activity, but it's a little unclear of what a gathering is, which seems broad to a lot of folks. Could you explain that?
Well, I think we've set I think the governor removed restrictions in terms of capacity for gatherings. We haven't placed still a capacity of 50 at social gatherings. So everything from, getting together for some type of ceremony, some type of event, both informal and formal. And again, it is broadly defined. The CDC guidance in terms of, I don't know if they have a set definition of gathering. We've just been looking at it again as any type of event or activity that pulls people together, and capping that at 50.
But can I give an example? Okay, so Brookside Garden that Councilmember Albornoz raised, there's more than 50 people there. They're not 50 people at a specific individual event. And so, so could a municipality, for instance, do a screen on the green with appropriate distancing that had 250 people, but separated with social distancing? What would be the gathering? To me, the screen makes that a gathering. You're gathering to watch the movie, but you're also gathering to go to the garden or to go to a park or a trail. So it's unclear to me what, if I'm not connected to the people and we're all going to the same destination, I think that's some of the confusion of what is and what isn't a gathering.
Yeah. So I think the spirit of it is clearly that it's segments of space can't have more than 50 people in it to protect the space. Now, obviously, we've talked about, for example, could you have an event that had two adjacent parking lots that were not connected to one another in any way, but were essentially the same event operating next to each other? Because the space is segmented and you can't have interspersing of those two people, if they had 50 in each of them, assuming it met the 1 for every 200 square foot or whatever, assuming it met the spacing requirements, I don't think we would necessarily have an objection to that because it's meeting the spirit of the rule, which is people separated by more than 6 feet. The problem is if you have a larger gathering, you could easily say, well, then Dr. Stoddard, couldn't you have 250 people in a very large space and meet the same thing? The problem is the more people you have in a space, the more difficult it is to ensure that those guidelines are being followed. And so we've set the limit at 50 to try and protect from what we know will often happen, which is that even though you have the amount of space, people tend to, we're social creatures and people will want to gather together, and just having, segments that are, if it's barriered off and it's spaced, you have 50 people in it, that's permitted. If it's two adjacent barriered off locations, having 50 people in each is fine, so long as you can't, you're one in, one out kind of deal.
Great. And then just similar to that, in the gathering, I've been to a number of places and I've been told that our guidance is not that you have to wear a mask in public, but if you are in a place like Brookside Garden, for instance, or some other area where you're with your family, are we recommending, which are two different things, folks to wear masks? I mean, I've been to Brookside Garden, I've worn my mask and been very happy about it and enjoyed that as a place to be outside. But
so as it currently stands in terms of those open public spaces, again, so our guidance is we're requiring face coverings where physical distancing is difficult to maintain, and that's part of the issue. So, when you're in a wide open space, I've never been to Brookside Gardens before, but when you're in a wide open space, again, some people choose not to, again, because they're within their particular clusters. So that's something that I think we could revisit and take a look at. But as it currently stands, the requirement is in spaces where it's difficult to maintain that physical distance. And then, some people would interpret to say this is a wide open space and I'm not required to do so.
But I would say, for example, we did see at some of the streeteries that people were waiting in line for like a rooftop patio, for example. Even though you're outdoors, if you can't be 6 feet apart, you should be wearing a face cover. So it's that judgment that is made. If you're in a confined space that doesn't allow you to maintain, not just transiently occasionally have 6 feet of distance between you and the other people around you, you're required to wear a face cover.
Appreciate that. I would encourage if that's the interest of what the health director is looking to the health officer is looking to do, I think that should be clear. I don't think it's currently clear, and I would prefer, for me as a total non-expert who has completely taken the guidance of the health office, but I think it would be easier to get compliance if you required face coverings in all public areas, and then allowed an understanding that on the gathering side, that if people are are not connected, as long as they're wearing, everybody's wearing a face mask, that there's little difference between one type of public gathering and one type of other place, because I still think that is unclear, and I think that the being stronger on the face mask and more understanding on the strictness of the gathering outside, particularly in public places, I think would be helpful, easier for residents to understand. I think it would induce a lot more compliance with folks, and I think it would keep people safer, at least from my basic observations, being at parks and being at the streeteries, and looking forward to some of the other open street concepts that we're now talking about doing. Okay, last question. I'm glad there were a lot of conversations about the youth sports. I still think there's a lot of confusion about what that is. I still don't understand what a contact sport is versus a non-contact sport. I'm not sure if there's a definition of that. I've gone to the CDC website. I've seen the video. There's a baseball mitt and a baseball helmet, and there's also a tennis racket. As part of that video, to me, tennis would not be a contact sport, although you are touching the ball and maybe wiping your mouth, and doing other things. But it's just very confusing. Are we allowing organized games versus just drills? To me, it would be helpful if we had a to do and not to do type of list for those activities, both training and organized games and casual games. But I think there's a lot of confusion and questions about that.
We've been in significant team chat conversation during this hearing with Sylvia, and to be clear, this is not on Ms. Kinch, who helped draft this. This seems to be, we need to have some additional conversation to clarify this, because I think, and obviously we do have flexibility underneath Dr. Gale's authority as the health officer to issue a sort of supporting orders associated with some of this work. And this may be one of those areas where, just to clarify, given we're dealing in part with a couple things here, and I'm not putting this off on the state. This is something we need to deal with locally. But where the state makes changes, it doesn't always announce the changes until you just see them in an order. And so unless you're reading all the orders to the letter, you may miss certain changes that have been made. And so this seems like an area where there have been changes made in youth sports that were unannounced or certainly not clearly announced. And we need to make sure that they still meet the intent of what we wanted to do in Montgomery County moving forward. And so we agree that with youth sports particularly, there's going to have to be some clarifications, and depending on the nature of those clarifications, it may be a communications element, or it may actually have to have some force behind it, and so a health officer order may be required. And we're going to take a look at that.
I appreciate it. I totally understand the challenges and concerns. I was going to say, actually, I think the confusion on youth sports and gatherings and some of the other things are not unique to us. I think that's true statewide. But if we're expecting our residents and our businesses to keep up with what the rules are and how to comply with it, we certainly need to make sure that we're up to date on what the rules are and how to comply with it. And I'll reiterate how I started: clear, consistent, easy to understand and comply with. We're not going to find perfect answers to these questions, obviously, as you noted. I know you're working your best with your expertise and the information that you have in order to try to keep residents safe. I certainly appreciate that, and I support you in that. I just hope that we can all work together to make sure that we're getting this information out as clearly as possible. And I think that chart in particular between what the state is going to be allowing starting Friday at 5 o'clock and what the county is going to be allowed by the different items will really help us to be able to communicate that clearly to the public. So thank you very much.
Thank you. Councilmember Navarro.
Thank you, Mr. President. A lot of my questions have been answered thus far. I appreciate everybody being here to discuss this. just a very general yet, I think, important thing to consider. A lot of conversation, no time and time again, has been centered around the issue, of course, of communication. And there's no doubt that, it's much easier to shut everything down. It's going to be so much tougher to do this gradual reopening and make sure that we're crystal clear on the instructions. So, I just want to offer just general observations about the critical nature of our communication strategy. And as has been mentioned before, this issue of it being, as concise as possible. Illustrations are great, so infographics, and literally this notion of how do we differentiate the message to businesses versus, families and the public. It's also, I think, a very good distinction. Very important. So I just want to, really offer that and reemphasize the importance of all of this. And I know this really falls under the communications team. So feedback on that as soon as possible, as clear as possible, so that everybody understands where we are in that process. The other thing I wanted to mention, so in conversations both yesterday during our Racial Equity and Social Justice Act first briefing at the in the Government Operations Committee, as well as conversations that I've had with Mr. Ohaney, who is now leading the COVID-19 communications effort, and also with Dr. Kroll. And I know, Dr. Gales, we're going to have also a conversation tomorrow about the impacted zip codes. But really, all of this falls under this notion of the approach to equity and understanding that disproportionality, knowing that those zip codes continue to trend in the way they trend. So as we're reopening and as we're recovering, it's really critical that we figure out how to integrate all of those efforts and be able to really do it under that umbrella of racial equity. I was struck by how in San Francisco, the first thing the mayor did there was to stand up this COVID-19 equity team that really focused on this issue completely, front and center. And so after yesterday's GO session, we, did discuss sending over to the executive a memo to ask to formalize this. I know it's been happening, but I feel like it has been happening in a much more informal way. But so we can formalize this equity team and really truly begin to fast track also some of the models that we've seen have worked very well, right? So we've had the conversation about the hub model. I know, Thriving Germantown, in collaboration, people like, Grace Rivera Elvin that have been working on this, et cetera. It's a really nice template and it really follows a lot of what we've said we wanted to do. So really fast tracking that and finding ways of standing up those kinds of places that the community they will know where to go and find all the information necessary. It goes to the issue of testing, goes to the issue of contact tracing, food distribution, information in general. All of that can be contained. So I wanted to highlight that as a, I think, structural way also that will help, I think, all of us communicate in a seamless fashion all of this information. No doubt we have to make sure that people from the community, trusted members of the community, are working in these, involved in these efforts, but also the issue of the multilingual, multicultural communication, which again, I had a really productive conversation with Mr. Ohaney regarding how do we identify folks in HHS to have that capacity. I've mentioned in the past that Ms. Sonia Mora, who leads the Latino Health Initiative, she's amazing. I mean, her expertise in public health is one that we should, I put her name forward a long time ago, we should be using in terms of communications as well. So this is something I think that I'm very excited of how this is coming together. Something that I think we can continue to utilize and deploy because this reopening in phases is going to take a while. So I look forward to integrating all of that and as well as all the directives because as everybody has mentioned here, we are 24/7. We are answering questions to our constituents. We're trying to make sure everybody's doing what they need to do. So the quicker that we have that info, infographics, simple things that we can put out there, I think the better and the smoother it's going to be. And I appreciate the conversation about, what happens if numbers start to go up, something that we'll need to definitely track. So just some observations and some follow-ups that will be coming, your way. And again, really appreciate everything that you have all done to get us to this point. Thank you.
Thank you. Councilmember Vice President Hucker.
Thank you, Mr. President. And thanks everybody for all your hard work as usual. I want to, a lot's been covered, but I have three areas I want to bring up. One is just a question to clarify, because I received a specific question from a owner of an indoor mall, I guess both indoor and exterior, saying that the guidance is unclear to him. And I read it here in number 9. They can open, as I understand it, Dr. Gales, as long as they allow customers to enter and exit interior entrances of merchants, but not to gather. And the stipulation is they have to comply with all the other measures, guidance under number 3, including masking and distancing and disinfecting. Is that all correct?
Yes, that's correct.
Okay, good. So does that mean, and he hasn't asked me that, but I'm anticipating, does that mean no food court, presumably?
At this time, that is correct. Yes.
And what about their interior play space with play equipment? That would be off limits too, just like parks, correct?
That would be correct, yes.
Okay. Anyway, I'll convey all that. Second, an ACAO had told me that tattoo parlors could open in phase 2, but then I see in 21E that they're on the list of businesses that remain closed. Am I missing anything, or are they remaining closed?
They are remaining closed in phase 2.
Okay, I gave bad information to a tattoo parlor owner. I have to clean up. Okay. And then 3, I want to ask you about nursing homes. I know they're not in the executive order, but this is our weekly briefing. A lot of troubling media reports this week. Problem isn't new. You and I have spoken about this quite a bit, and we brought it up here. The state is still, according to the media, underreporting the data on their state dashboard. Hundreds of cases and casualties are apparently missing from the state dashboard. Can you remind me, does that affect your reporting in your dashboard, or do you gather your own data that doesn't come from the state?
Sure. So that's an excellent question. And I think one of the other components that was brought up for clarity and my understanding and trying to find out more information is part of the underreporting was that when a nursing home may be cleared in terms of not having cases, that those numbers were taken off from the total count. The count that we have here is reflective of the line list that our disease control staff has in terms of reaching out.
They were taken off from the cumulative count of cases and casualties in the state?
So that was one of what was reported. I don't know if that's in fact the case, but that's one of the inferences in terms of why there is a discrepancy. The number seems lower some days versus where they were before. What I can tell you is, and again, I can't speak for the state on that, but that was one of the inferences from the article. What I can tell you about our data is informed by the line list that we have. So whenever there is a case that pops up in any of those facilities, we go in and we count. So we count the number of positives for residents as well as staff. We track over time if there are any new cases that pop up. So our total that we publish on the county website, it's on the same page. I'm thinking in my head with the dashboard. If you scroll to the bottom, we break the numbers down by nursing home facilities and non-nursing home cases, both for the number of cases as well as the COVID-related fatalities. And so both of those represented. Our numbers represent the numbers that we collect as a part of those investigations and are accurate as best as we can tell.
Right, based on your own data that's gathered and not just from the state.
Yes.
Okay. Thank you. A couple specific germane media reports this week. I think in my district, possibly in Councilmember Navarro's district, but Bedford Court Health Center in Silver Spring told a regulator apparently they hadn't established a separate unit for COVID positive residents, and the spokesperson for their parent, Sunrise Senior Living, refused to respond to questions. Althea Woodard Nursing Home, regulator reported gowns worn improperly, with holes in them, administrator falsely reporting that he was overseeing an infection prevention system, but he had not been trained in it. And then also additional media reports that the state won't disclose which nursing homes have been fined. They say that several nursing homes have received substantial fines, but they haven't released any details on those. They had to be gathered under a Public Information Act request. Do you know which homes in Montgomery County have been fined, and do you know how much they've been fined?
I don't. If the state has fined them, then the state has done that, and I don't have that information. Now, that said, I would enjoy having a conversation with you after this to discuss more in detail about those particular instances, so that I can find out more information about them and see what we can do on a local level to intervene.
If you find out about nursing homes that are out of compliance and haven't been fined by the state, do you have the authority to fine nursing homes separately or above what the state has fined them?
So it's a little complicated, but ultimately we do have some provisions in terms of where we can exercise some space in terms of the penalty process. Again, it's a little complicated, but I'd be happy again to talk with you offline.
And then just, I wouldn't enjoy that. I'd appreciate that. The opportunity. Thank you. This is something that's been going on for, at least 8 weeks or so now. I've heard from a number of constituents who have been fighting with nursing home management, really all over the county, some in Silver Spring, some in Rockville and Gaithersburg, to get information about their loved ones. It seems like nursing homes are still withholding that information a fair amount. Generally, how would you characterize the state's oversight of nursing homes? And is there anything else that we could be providing you to improve that oversight?
Well, they have it's a tough job. And then in terms of the number of cases that have popped up in terms of trying to manage those cases and provide testing. So what I would say is that what we are doing on the local level to go above and beyond is to provide a tighter communication as best as we can to be up to date in terms of those issues. And when we find out those issues, quickly be able to triage them and address them. For example, the response that we have now in terms of stepping up to drive out the cases in both nursing homes as well as assisted living facilities is to go in and test on our own and provide that testing and do it on a weekly basis, again, so we can drive those numbers to zero. We have cleared a number of nursing homes who now don't have any cases, that had them before. As well as looking at other strategies to step up in terms of making sure that they have those provisions in place, whether that's through physical in-person visits or virtual consultation.
Thank you. And to be clear, you've been providing the testing. You've also been providing the PPE for nursing home staff that need it, correct?
So the testing, the majority of the testing that has come through has been provided through state provisions.
Right.
So in terms of the universal testing with the National Guard. Now the PPE that has come through is we have received significant provisions from the state that have been earmarked for the nursing home facilities going back to when the Secretary's first directive came out. I want to say it was in early April, talking about face coverings, those kinds of things. Now, there have been other opportunities where we have been able to tap into our supply to provide, particularly to the assisted living facilities who have not had a dedicated supply from the state for PPE, as well as providing additional PPE support for nursing homes who had additional needs beyond what the state has supplied.
So just to be clear, thank you. If there's any nursing home management or staff or residents or family members of residents who are watching or listening, they should get in touch with the county if there's deficiencies in any PPE in nursing homes in Montgomery County. Is that right?
Yes.
Right. Okay. People should know that they can do that. Okay.
Yeah.
I look forward to our follow-up conversation. Thank you, Mr. President.
Thank you. Councilmember Raymer.
Thank you. Okay, so to follow up on the discussion about masks first, or face coverings, I think it would be very helpful to have under item 3, which is kind of the very general operating, guidance of the executive order. Just a very simple statement that reflects what we've been saying, what you've been saying, Dr. Gales, that, you know, all persons in Montgomery County shall be required to wear facial coverings wherever social distancing is difficult. And that simple, you know, one statement there as a sentence in kind of the overarching component, I think would clarify a lot of other places where it seems to refer back to itself in confusing ways. And people just, you know, I think this is one where we want to have a very simple declarative statement. I guess I cannot amend this regulation. This is the executive order. So I do want to ask about the process to receive a slightly different version from the executive branch so that we can approve, you know, a different version. So that's the first one. And then related to that, the second item, if I'm understanding it now, I do see youth sports clearly being limited to 15 per the state's youth sports document. I see that now. Adult sports appear to be limited to 50 per our outdoor item. Number 4, I see Dr. Gale sort of having a, what? That wasn't necessarily what I wanted. But item 4 says sporting gatherings. Is that the same? Or so if I'm reading this correctly, it appears to me that 50 people is the limit for adult sports, 15 for youth.
So the facial expression I gave you was more of a.
It's the same one I'm having.
Yeah,
We're on the same page about this.
I that's clarify. So I think the sports gathering is in terms of event, but I think this, we can talk through that language because I want to make sure I know exactly what you're talking about in those specific.
Where is this? Where should I look for guidance about adult sports? Adult soccer teams that want to permit a field. Where should I find that? Earl, anyone?
Yeah, I don't think we specifically address adult. I mean, so basically we're extending what we're permitting to allow. And so technically by those definitions, and maybe we will need to clarify this, and what I'm getting from Ms. Kinch is that one way to deal with the question of the executive order modification is that we just have a complementary health officer order that can follow the executive order that states very clearly the requirement around masks, if that's something that council is amenable to, so that we can, but I think we agree. I think we agree in principle that this is the message that we want to be providing, is that regardless of setting, indoor, outdoor, or otherwise, if you can't maintain physical distance, you're required to wear a face covering. I think Dr. Gales would agree with that as a principle. It's just we need to figure out exactly how to, I think that we could do that through a health officer order.
And when are we taking up the county council acting as a board of health order? That's, Bob, is that now or is that subsequent?
Isn't that
what we have?
Council will be acting as the Board of Health, but I think it would be incredibly confusing to have an executive order saying X and the Board of Health regulation adopting an executive order except for this. I think putting out Dr. Gales putting out a health directive to clarify the order or modify it in some respects is a reasonable way to go, or they can come back with an amended executive order in another council session.
Well, that's the issue. So for all this discussion today, to the extent that a change is needed, we're going to need to receive a new executive order and then act on an amended executive order. So we might act today on this order with the expectation that we might also have to act again on Friday if there is an amendment that we feel is important enough to merit an action. I would be fine with Dr. Gales issuing one clear, order on facial coverings. That would be fine. I think that would probably serve the need to communicate with the public in a very precise way. Then the sports issue is a little different. I think we do need some clarification, because it does look that it looks like 50 is the limit for outdoor activities, which I think is generally where we've been going, and that could be fine. But then it also seems like 15 is the limit for youth sports, and now I'm thinking why these two things are kind of at odds in terms of health basis.
Well, there's also the third possibility is for some things can just simply be put out as guidance as to clarifying what the executive order means. You know, but the council doesn't have to approve a health directive from Dr. Gales. That would be something he has separate authority to do outside of the executive order, to restrict something that's in the executive order for as long as it's based on his opinion in science. He can do that. So that's one way to do it. Or they could come back with an amended executive order, you know, and we can, I mean, you could approve this and then they could come back with an amended executive order. You could not approve this and they can come back with an amended executive order. Or you could approve this and Dr. Gales could issue a health directive that clarifies some of the questions that have come up.
I'm happy
Might
to
be the
support,
better way to go.
I'm happy
And
to
then it
support,
doesn't have to come back to the council.
I'm happy to support a directive by Dr. Gales on facial coverings that's, you know, very broad. But that resolves that issue when we see that. On sports, I think we've got an issue here. It's confusing as to what sports are. And then I have to ask, you know, to the county executives team, is what you intend that youth sports is 15 people limit, adult sports is 50? It doesn't feel like we have fully resolved what we want there. So I think we're going to need something from you. How to do that, I'm not 100% sure yet. We're figuring this out as we go. So any comment there is welcome.
Well, so clearly, I think even based on what the state is doing, it's 15 for youth sports, as you alluded to, and there is no limit on other gatherings per the state. And so we're enforcing a separate limit. And so that discongruency, as you said, from a public health perspective, and this is definitely Dr. Gale's territory, there is rationale for why certain youth activities are restricted in a way that's different from adult activities, because we know that compliance with the other things around physical distancing is more challenging for children. I have a 6 and a 10-year-old, and I see visual evidence of that every day. So we know that, like for example, between 2 and 9, we're telling people you should wear face coverings.
Okay.
I know 2-year-olds are not going to wear face coverings as consistently as a 10-year-old or a 15-year-old or a 25-year-old. And so just recognizing that in the youth activities, we want to err on the side of being a little bit more protective, because we recognize that the other compliance issues are not going to be as good.
Okay. I mean, I think I can be okay with that, if that's where we're going. Just want to make sure that this is all intentional, really, more than anything. All right, thanks.
Thank you. Councilmember Rice.
Well, thank you. So I have a couple things that actually haven't been said, so I'm surprised towards the end. One of them is regarding when it comes to resources for businesses. So I'm going to try and go through these very quickly because I know the hour is late. We have the MoCo PPE website. And so I know personally of a business here in the county who went on the website and tried to acquire some of the PPE items. The shipping, just to let you know, so from a pricing perspective in terms of what we offer to our constituent businesses is very, very high. In fact, if you were to order $15 in masks, you pay $15 in shipping as well. So you pay double the price. And so I just want us to take a look at that and make sure that we're giving the best sort of setup, especially since other companies offer free shipping. It really is something that may be a pricing deterrent to a lot of businesses. So just wanted to highlight that for you. Also, one of the other things that's missing from that is the cleaning chemicals that are required by businesses. Since businesses now are required to actually clean much more frequently than they have before, especially when it comes to some of our businesses that turn clients in and out, a la hair salons, nail salons, etc. Those are the kinds of things where they're burning through those items much more quickly, and they're not available at grocery stores nor at home improvement stores. And so if we can look at the acquisition when it comes to those types of products to help and put those on our MoCo PPE website as well. I know it's not PPE, but it's along the same lines. I know that would be incredibly helpful to businesses because I know that they're struggling in that acquisition because it's not readily available. And I'm not talking about your big box stores and things like that who already have supply chains, but your mom and pop stores, your smaller businesses are the ones who are going to face difficult times in trying to procure that. I'll stop there for those two. If you have any comments, if not, I can move on to a couple of the other comments or questions.
I think both of them are reasonable things. We'll take them back, and I'll talk to Director Shetty about. I know he has a big fan in setting up the MoCo PPE, so we can talk about the shipping issues and cleaning supplies. From what we've said, so they're utilizing similar vendors to the county for PPE. We've also heard from our vendors on cleaning supplies that we're not having much issue acquiring them. So if we utilize a similar platform, we should be able to provide that support, assuming that the three businesses that are the back end of the MoCo PPE works for them. I don't see an issue technically with doing that. So let me go back and take that back.
Thank you very much. Appreciate that. So now when it comes to facial coverings and when it comes to gatherings, it was a very interesting conversation because I think what's lost oftentimes when we talk about gatherings is about the increased risk that happens as you increase the number of people. The infection rates are based on, and risk is based on statistics. So the larger the number of people you have, the more likely it is that one of them is actually going to be infected and then risk infecting others. And even when it comes to, and again, I'm not a doctor, not an epidemiologist, I just read a lot. Even when it comes to some of those folks who are wearing facial coverings, we know that facial coverings are not the panacea to being infected, and people don't wear their facial coverings correctly. And so I wanted to talk about a couple things because I was actually out at the Kentlands last night. My daughter had her 8th grade promotion last day, so we went out to the Kentlands to eat outside, and I observed, and it was very interesting. I observed a couple things, and I'm not going to call the business out, but the one business that had tables outside did not clean their tables between customers. I had to remind them and did tell them who I was, but just said, hey, every time a person leaves, you need to clean the tables. That's part of the regulation. They begrudgingly, even though they didn't have anybody inside the store, inside the restaurant, and so nobody's really doing anything, but they certainly could have gone out and did that. And they did it when I requested, and that was all fine and good. But we need to remind our folks to continue to do that and be vigilant about that. The tables weren't spaced at 6 feet apart. They were actually a little bit closer than that. And so when you had the back of another table and patron, they're much closer than that 6 foot. It wasn't even probably 4 or 5 feet. Like, it was close, probably about 3 feet. And so we actually placed ourselves and had a table in between us and in between the next set of families that was out there. There were only 2 of us out there, fortunately. But I could see that running into problems and issues as well, just in terms of reminding people and really focusing on the spatial distance and reminding folks while they want to try, they have minimal space, right? So they're trying to pack as much as they can to maximize. They're doing it at the detriment, the potential health risk of others and causing problems because then folks don't want you to be there, and all that could do is cause a problem between 2 patrons who don't want to be close to one another. When it comes to the wearing of masks, I will say that my take on it is that I'm seeing less and less people utilize them. While other people may have had a different experience in terms of a majority, I'd say maybe it's about 70% now, and it seems like it's getting worse. It was much better before. And I think that it's because we're starting to open. And so that's why I do think that this guidance in terms of us utilizing masks, even when outside, look, the reality is this, and as a person who, and many of you go to the gym and exercise, look, there are training masks that folks use. So there's no such thing as not being able to breathe or exercise through a mask. In fact, some of our best athletes use them to make sure that their systems grow even stronger by utilizing them to deprive the body of oxygen to make sure that it can more effectively utilize it when it comes to exercising. And so from that perspective, certainly if you have health conditions, obviously those kinds of things, but as far as from an exercise perspective alone, it is not an impediment at all. I mean, I wear a mask every time I go snowboarding and skiing. And, you know, it's one of those where, again, it's right on top of your face, as many people who participate in winter sports do. It's a tradition that you do. And certainly, you know, it's something that has an impact, but certainly something that's not possible to be utilized. And so I really would hope that we continue to push the idea of utilizing masks as much as possible. And we should be using them regardless of whether we're walking outside on the street or inside a building, because it will help to minimize, even though it's not the panacea, even though it's not going to stop something and, you know, keep the virus from definitely spreading. The reality is that it does help in a lot of instances. And so from that perspective, I do agree with what Councilmember Reamer was saying. We do need that broad guidance to remind folks of why, even though we're opening, we need to continue to use a mask. So I'm just curious as to your thoughts about some of that and some of the pushback on folks who want to push back to you to say, well, you know, we shouldn't have masks in gyms and you know, outdoors and all those kinds of things, because according to what guidelines I'm reading, when it comes to our CDC as well as other countries, one of the ways in which they've been able to minimize is by religious use of masks, right? And so that's been one of the things where they've been able to actually eliminate. They actually had mandatory requirements for everyone to wear a mask, regardless of whether you were inside or out. So if you could comment on that, and also about the number of people and the gatherings, because that's the other thing, because the larger the gatherings, the more people you have congregated together, the higher the percentages go. So if you guys could just comment on those.
Sure. I think the first component, great question. So for the first one, in terms of masks, for the folks at home, I think this gets back to an earlier point in the conversation in terms of us not being out of the woods. I think that the thing for folks at home to understand is we've been able to say our numbers are improving because we have kept these procedures and protocols in place for a longer period of time. And it's important that as we twist the faucet, not turn it all the way on, but as we twist it, that we remain even more vigilant, because we can really drive this out of our communities. And it's a combination of all of the different things that have been mentioned on the call today, from getting the cases down in nursing homes and DME group homes, and making sure that we've got the right provision in space to make sure that people are doing the right things in terms of utilizing swimming pools. It's a constellation of all these different things. Face masks are a significant component to that. Because again, it's not the panacea, but it does block transmission, particularly for those individuals who are asymptomatic. And that complements our push to expand testing, particularly to identify as many of those asymptomatic individuals as possible, to remove them out of circulation for their necessary time where the virus can go through, they can convalesce, and they can become non-infectious. So I say all of that to say that, yes, I think we can put out some further guidance to strengthen what we have been saying, but, you know, formalize it in writing in terms of the use of face coverings in different places. So that also spreads over into the conversation about gatherings. I think in this situation, to be perfectly candid, we're not talking about, our hands have been pushed a little bit because we're not talking about gatherings in an innocuous sense. They're gatherings focused on particular public health issues that we know are significantly impacting our communities, and quite frankly are addressing a lot of the same issues that are driving these disparities in outcomes, whether it's COVID or the previous, historical health disparities that have been in place. And so there has been, quite frankly, an approach, I think, universally across the country of a harm reduction message, at least from public health perspective, to say, if you're going to do this, and we understand why you're doing it. We're not saying no, but we understand why you're doing it. Here are the tools in place that you need to do to maximize your safety. But at the same time, there are risks. I know that there are a number of jurisdictions who are pausing their reopening to really get a sense of, who have probably had more large gatherings than we have had in Montgomery County, in terms of to see what the impact of it is. But going back to, again, I think one of the original questions, I think from Councilmember Glass, is that here in our county, the numbers don't match up in terms of suggesting that we've seen an increase of cases in the setting of increased large gatherings. Now, I'm glad to hear anecdotally, I can't say that I've been to any of those in the county, that there are reports of adherence and compliance with the face covering directive. I'm pretty sure that there are other jurisdictions that can't say the same. And so I think that we still have to be certainly mindful of that and make sure that we have increased provisions for those who have participated in the gatherings to make sure that they get tested as quickly as they can to identify anyone who may have tested positive and take them out. One point I will say about what was interesting, and I think this was the case in DC, and forgive me if I'm wrong on this, is in fact that they found that they had a number of law enforcement folks who were not wearing masks who actually tested positive. So it was actually, less on the gatherer side and more so on that. So I think that underscores that everybody should be wearing them and making sure that those provisions are in place for everybody across the board to be safe. I hope that answered each of your questions. Feel free to let me know.
No. It was great. And so as everybody's kind of weighed in terms of what their personal understanding as well as preference would be. Look, for me, I completely understand folks want to get back to normal. I understand folks want to see other folks. We all do, right? I haven't seen my best friends in a very long time, but it's not worth it to me to risk my life to do this right now and to rush this. And I would hope that other folks in the community also respect and understand that. And I think that it's important for us as elected officials to also send a message that it's not just about you, it's about us, right? And while you may want to get out, while you may be tired of being cooped up in the house, you should also care about other people and care about your fellow community and the risks that are out there. And folks really just don't know. I mean, what another person and their life entails. I had shared before that one of the employees that works for my wife actually has a severe health condition, and so is incredibly at risk. And so it was very cautious about not only coming back to work, but what the protocols would be, and then has a family member who is at risk as well. These are the kinds of things where, again, we don't want to take this for granted, and you would never know looking at her that she had underlying health conditions and those kinds of things. And so, again, I hope that people take that next step, right? You don't know the person who's recovering from cancer. They always don't have hair loss and all those kinds of things. You don't know the person who's got diabetes and hypertension and high blood pressure and all these other things. Those things don't present in a physical manifestation in terms of you being able to see them. But that person then becomes more susceptible and more at risk. And so therefore, by us continuing to proliferate this throughout the community and not taking the appropriate steps, says that we're not really being concerned about them. And as we, put in place this resolution earlier today, talking about racism and public health crisis, I just have to say this because I think it's important. And it's something that my family's talked about. It is interesting that folks are moving towards very quickly going back to opening and moving forward, understanding that the people who are most at risk in our community are people of color. The people who are opening up these businesses and working in these spaces are people of color. The people who are suffering from these risky preconditions are people of color. And so who suffers as a result of us opening too quickly? People of color. And so I just want to be real about that in terms of saying that while we're passing this resolution and talking about racism and the public health crisis, let's be honest about also how it's affecting our people of color in our community and putting them more at risk. And so we need to be very careful about what it is that we do, the procedures that we adhere to, and what our message is. So thank you, Mr. President.
Thank you. Might I remind everybody, we're over an hour past when we were going to have our public hearing. We still have Councilmember Jawando, who has not spoken for the first time. We have Councilmember Reamer, who has spoken more than once, and we still have not heard from Dr. Stoddard. So we do need to be as succinct as we can. Not for Councilmember Jawando. He has not spoken yet. So please.
Thank you, Mr. President. I will still adhere and be succinct. Good to see you, Dr. Gales and Dr. Stoddard. appreciate the questions of my colleagues. I have a specific question, and I agree that facial coverings, all the things that Councilman Rice just said, couldn't. I'll second that and third it and fourth it. It's exactly right. We have to keep safe for the benefit of all of our most vulnerable residents, our seniors, everybody. So that's the message. And we've done it the right way. I was talking this morning to somebody that I'm glad we've taken our time. I'm glad we've proceeded with caution. And we haven't couched to political pressure, which you're seeing disastrous results nationwide with people that move too quickly. And so we're doing it the right way. So I understand it's frustrating, but be patient. My specific question, and I not only say this as a father of 4 young children like Mr. Albornoz, but many parents who are trying to figure out what are they going to do as school just ended last week. What are they going to do with their children? How are they going to keep them busy? We talked about youth sports, but specifically in regards to things like indoor gymnasiums, like gymnastic studios and things of that nature. The way I'm reading this, and I just want you to clarify, is that if you had a gymnastics studio, for example, but there's other indoor activities like that, they can open, but they just need to adhere to the 200 square foot requirement and then also the youth sports under 15, or where would they fall into this category?
I think that it's the type of business and the type of entity. So it would fall, and again, I would defer to the legal team on this, but it would fall in the category more commensurate with a gym type facility, as was pointed out in terms of the fitness with the dance studio, similar in the same way. So it would be required to follow those restrictions that have been put into place in terms of face coverings as well as spacing and capacity guidelines.
So so if you had a youth gymnastics studio, that would fall under a gym. And if Ms. Cinch, the attorney, is on, I'm happy to hear from her as well. But that would be just the square footage requirement, not the cap on people for youth sports. Did I hear that correctly? And the facial coverings and everything else, obviously. I don't know. Maybe I'm misstating what you said. I just want to be clear about this.
I mean, I think it's a very specific example where I think there would have to have application of multiple provisions. So from a physical building perspective, it's a type of gym facility which would be restricted to that. And it's a youth sports related activity, which would also be subject to the youth sports guidelines in terms of capping the number of people who could participate. I think that's right. Is that right?
Ms. Kent?
Yes, I agree with Dr. Gales' interpretation of the order. There would be sort of a possibility for overlap in provisions depending upon the targeted age of the participant.
So I use that as a general example, maybe one of the most prevalent, but I think I can think of others where there are specific activities for youth that are indoor, and where I think it might be worth having some additional guidance just on those types of entities for people who are trying to figure out, for not only us parents, but for the businesses themselves that are trying to figure out how they're going to interact and do what they need to do this summer. So I think that could use some additional clarification, especially since it overlaps with multiple parts of the order. And that's the only question I have, and just appreciate your work and all the things that you all are doing to keep us safe. Thank you.
Thank you, Councilmember Reamer. We are going to go to the 5-minute rule, and please,
less than that here. Just
okay.
Playgrounds. What's the current, with this order enacted? What will be the requirement on playgrounds?
They're not open.
They remain closed.
Yes.
Okay. Thank you. Just wanted to clarify.
Hold on. Let me. There's so many provisions within it. So let me pull back. Let me defer to Ms. Kinch on this because I've got.
Sure, Ms. Kinch.
Yes.
All right, so playgrounds are open. They do have to follow the general operating requirements, so people should still socially distance. They should wear masks. Obviously, I don't believe that we would be providing hand sanitizer or anything for those facilities, but parents take their kids to the playground. They have to decide if it is worth the risk to do so.
Let me pause you there. It could be a challenge if there is an expectation that the Parks Department is going to be able to sanitize playground equipment. I don't know that they can't meet that expectation. So does the order?
I don't believe there is that expectation for them, but I think that could be clarified in guidance, since it has been raised as an issue.
Yeah, I mean, I think it might be premature to direct them, to allow them to reopen, given that Parks has very limited ability to sanitize. So I think okay. All right. Well, so the order that we see in front of us allows them to reopen or reopens them. And then where is the related guidance?
So yeah, there are. We can look. I believe the state has issued guidance on playgrounds and how to safely operate them, and we can link to that because, frankly, to be totally honest, and I would say, not to say that the sanitation of the equipment is not necessarily the reason why we didn't open playgrounds previously is largely because they are an attractive gathering point, not necessarily that they are the equipment itself is a particularly high risk. Even since we originally closed playgrounds, additional data has come out that suggests that the surfaces, particularly outdoor surfaces of the kind of material that we utilize in our playgrounds largely, are less effective conduits of disease spreading. Like I said, outdoor, all those things, there's multiple things stacked up against the virus. So I think that's less of a concern than it is the actual distancing and the congregation point that a playground represented, which is why we didn't do it in our phase 1 and it is part of our phase 2. We simply offset it from what the state has recommended.
Okay, if you could please follow up with the Parks Department and just sync up there so that they can get your guidance, know what to say publicly, because they're probably going to face requests from the public to have sanitization crews out there constantly, and they can't do that. So we need to explain why that's not needed, or else we need to shut them down. And
to be honest with you, the Parks Department has shared with Dr. Gales and I a document about how they intend to, meet the spirit of the rules, particularly as it relates to bathrooms in parks and other things like that as well. And so they've already provided us some feedback, and we'll be working with them to make sure that is in effect.
Thank you.
Okay, thank you. Dr. Stoddard, though we've heard from you several times today, you have not given us a report. Can you do that in less than 5 minutes?
Yeah, I can just give you the highlights of the big things I wanted to hit on. So, and I hit on some of it by virtue of some of my answers, so I'll keep it concise as it relates to that. So, obviously the ambassador program we've talked about a bit. We've visited 1,143 businesses so far. Very limited number of issues. In those cases, we've worked with the business to remedy them. Sometimes there were indoor restaurants that were already operating. There were some lack of PPE in some places, some lack of clarity about the distancing requirement as it relates to certain portions of the store activities. And we worked with them to do this, to work with them to correct it. And so we finished one round of all the zip codes across the county. And we're going to do a follow-up round, and particularly focused on, number one, the businesses that we reached out to in phase 1 where there were minor issues, so we can do some follow-up to see what whether those issues are still being managed correctly. And then obviously they're ramping up for what will be the initiation of phase 2 at 5 p.m. on Friday. And so we will continue this program through phase 2 as well, with the obvious direction to make sure that we're providing additional contacts to the places that are seeing expanded activities. In addition, we shared information with the regional service center directors on where we saw limited issues of noncompliance, so that they could help us in communicating out to the businesses in the various regional service center districts or areas, and also allowed them for some additional follow-up. Many of them did a great job, particularly as it relates to our streeteries, our street dining options, to go through and do a business by business, look and provide some feedback on places where we could improve both the messaging and the sort of the communication of compliance needs with those businesses as well. And so those areas have seen particular interest. Similarly, I would expect to see particular focus on things like pools and malls and other areas where we're particularly concerned about them as part of phase 2. A couple other things. So PPE distributions continue as we previously discussed. I know Councilmember Reamer had asked for an assessment of how many masks we've distributed. I think we shared the county purchased masks, and I could provide those numbers, but I think we're still actually we are still outstanding to provide to him, and we'll provide to the whole council an update on the total number of masks. We, like as was alluded to by Dr. Gales, we received some from the state or federal government that we pushed forward as well, and those weren't included in the initial numbers that we provided to Councilmember Reamer. And we got to those numbers are tracked a little bit differently. I want to make sure we get a more full answer on that. I'll provide our standard 311 update, and what you'll recognize in this is that we've seen a continued reduction in the COVID-related calls coming into 311. There were 333 calls on COVID that were COVID-related in the 311 yesterday, which was roughly 15% of the total call volume. The call types, it's the EARP and the HHS Rental Assistance Program, despite their application periods being closed, still receive approximately 42% of the COVID-related calls on those two programs. And about 80% of those calls were in Spanish, the EARP and the rental assistance. Otherwise, the focus continues to be on the normal county services, ride-on modifications, solid waste, permitting services, for the most part. I'm not sure if there's anything else major. So as it relates to, I wanted to raise the point that I met with Chief Equity Officer Ward on Friday. We are doing a training for our entire recovery framework, all of the facilitators of our work groups, our mission area leads, on how to implement racial equity into our ongoing conversation related to recovery. In addition, we are sitting down with Officer Ward Equity Officer Ward to review the actual documentation that we've utilized to track recovery, to ensure that racial equity principles are built into exactly not just the conversation that we're having, but fundamentally and systemically into our process for documenting and ensuring compliance with the recovery standards. I think that's not to say that the suggestion of a COVID-related equity group is not appropriate. I think that's actually, I think I'd be very interested in hearing that conversation as well. But I think just in support of what Councilmember Navarro had raised, we are doing already some activities related to addressing racial equity in our recovery framework, and I wanted to highlight those as well. I will stop there and certainly can entertain additional questions.
Well, thank you. There are no additional questions for this moment, so I'm going to jump on that chance. And thank you all for being here. We are going to go. We're only an hour and a half past where we should have been, I guess. But we're going to go directly into our public hearing as a Board of Health regulation.
I think you need to introduce the Board of Health regulation first and then do the public hearing.
Okay, so all right, so we need to, I guess it's all the same, but if you could introduce it, please, Mr. Drummer. We're going to go directly into the public hearing, and we do have speakers for that. Please.
All right, real quick. Sitting as the Board of Health, the Board of Health regulation would adopt Executive Order 82-20, COVID-19 Local Order Phase 2 as a Board of Health regulation. Now you can have the public hearing.
Thank you. We are going to go to the public hearing. Ms. Kennedy is on. I see her name. I don't see Ms. Kennedy, but I see her name. Ms. Kennedy, are you ready to conduct the public hearing, please?
Yes, sir. We have one speaker.
Let me read into the record. Good afternoon. I guess it's good afternoon, ladies and gentlemen. This is a public hearing on a Board of Health regulation to adopt Executive Order 82-20, COVID-19 Local Order Phase 2. Action is scheduled immediately following this hearing. And Ms. Kennedy, please.
Thank you, Mr. President. We have one speaker for this public hearing who is on the line, and that is Elliot Chabot.
Good evening, or good afternoon. My name is Elliot Chabot, and I reside in the Strathmore Belpre neighborhood of Aspen Hill. I'm the immediate past president of the Belpre Recreational Association and currently sit on the board of directors of the Strathmore Belpre Civic Association. I'm here to request a clarification in the proposed Board of Health regulation and, if need be, to request an amendment. Our two neighborhood associations have for many years sponsored summer movies. We would like to be able to hold a drive-in movie this month if the regulations allow. We would hold this in our pool parking lot with masks, with social distancing, with 360 square feet per family, and we do expect to have over 50 individual people among those families. The governor's order of May 27th, which he reaffirmed in his orders of June 3rd and June 10, specifically allowed drive-in theaters to operate in the rest of the state since May 29th. Drive-in movies are not specifically included, however, in the list of outdoor recreation permitted in Section 13 of the county executive's COVID-19 Phase 2 order. What we do not know is whether the list in Section 13 is intended to be exhaustive or is intended to just be illustrative. So my ask this afternoon is that you either indicate that Section 13 is intended to be illustrative and that drive-in movies are another example of permitted outdoor recreation, or alternatively, that Section 13 be amended to specifically include drive-in movies. Thank you much.
Thank you, Mr. Shabbat. That concludes our speakers, Mr. President.
Thank you very much. We will close the public hearing, and the public hearing is now closed. Does anyone want to, is there anyone on the call still, or Dr. Gales or Dr. Stoddard still on this call that they could answer this, Mr. Shabbat's question?
Yes, I'm still here. Yes, I'm still here.
Okay, please.
I think there could be some consideration to make provisions for this to happen without having to amend the executive order. We would be happy to talk offline with the community group to find out more about what activity they're proposing and what provisions could be potentially put in place to facilitate it happening.
Very good. Thank you very much. So, Mr. Drummer, let me turn back to you for a logistics exercise here. It is my understanding that we should introduce and vote on the executive order itself, and then vote on the Board of Health order. Is that correct?
Yes, there's two separate resolutions in front of you. One is to approve the executive order. Absent your approval, it doesn't go into effect. And that's a yes or no, either approve it or do not. Then if you approve it, assuming you approve it, then you would go to the Board of Health, go back, sitting as the Board of Health, go back to the Board of Health regulation that you just had the hearing on, and decide whether or not to approve that resolution, which adopts the executive order as a Board of Health regulation. And just to clarify, the executive order I'm talking about is the one that was amended this morning to include the guidance on swimming pools. That's not the one that's actually in the packet. It's the one I sent around, I guess it was this morning, late this morning. So those are the two things in front of you. The reason for the two is the Board of Health regulation. If you adopt it as a Board of Health regulation, it would be applicable within municipalities in the county, throughout the county. Simply approving the executive order leaves the question as to whether or not it's applicable within municipalities in the county.
Mr. President, I'd like to move that we approve the resolution.
It's been moved by Councilmember Javando. Is there a second? It's been seconded by Councilmember Navarro. All those in favor, please raise your hand. And that is unanimous. Thank you very much. Next, we are going to vote on the Board of Health regulation, sitting as the Board of Health. Is there a motion?
So moved.
Who was the so moved?
Gabe.
Gabe, Councilmember Albornoz. The motion was made by Councilmember Albornoz, seconded by Councilmember Rice. All those in favor, please raise your hand. And that carries unanimously as well. Thank you all very, very much.